6 years into my public health nursing career, I did the math. Constantly on call, buried in caseload, and barely making a dent in my retirement savings, I would have to work until I was 78 to retire comfortably. That was the moment the floor dropped out from underneath me. I wasn't just tired, I was trapped. If you've ever felt stuck in your healthcare career, hit subscribe. I'm about to show you the way out that changed everything for me. I'm Cindy and I'm a nurse. I retired at the age of 62 after a 43-year career because I couldn't do it anymore. That number 78 haunted me. It followed me on every call, every report, every long night working after hours. I love nursing. The science, the problem solving, protecting my community and serving others. But it was taking everything, my time, energy, mental health, and my future. A 2025 survey found 65% of nurses report high burnout. For every 1% rise in RN turnover, hospitals lose about $300,000. That isn't just emotional, it's financial. I was one of those statistics until I found a different path. So stay with me. I want to show you how I went from being burned out to earning online, doing something I love. The reality of the golden handcuffs, right? In nursing, we call it the golden handcuffs. The pay's decent. You're not going to get rich. The job is generally stable. The title, they say it's respected, but we don't always get treated like it. Those cuffs get tighter every year. I'd finish 10-hour days of contact tracing and outbreak management completely drained, especially dealing with private citizens who don't want to hear from you. How did you get my information? How do you know I have XYZ disease? There's a reason it's called public health, right? But there was no energy left for life, for my family, friends, certainly not myself, and no volunteer work. My retirement account, a joke. I was a ghost in my own life, and the system was cracking. Turnover is above 16%. Why? Because nurses are not retained. There is no effort putting into retain nurses, be it through salary, benefits, what have you, mental health days. We are not rewarded for longevity. Each nurse replaced, it's about $61,000 down the drain, and I could feel it every time it happened. So, comment handcuffs if you've ever felt trapped. My breaking point wasn't loud. I didn't even know I was breaking. It was very quiet. It was random. I'd sit in my car outside my office and I didn't want to get out. My kids said, "Mom, something has shifted with you after COVID, not from the disease, but from taking care of everybody else, trying to prevent disease, trying to track cases, trying to keep other people from getting it." I was just completely numb and staring at the door. All I could think about was that number, 78. I had followed all the rules. I had gone to nursing school. I had gone on and got my degree from a respected program. I had a good public health job. I loved the best job of my career. But those rules were leading me to a life I didn't want. My kids were grown. I finally had some freedom, but I didn't have the money to live life on the way that I wanted, on my terms. Quitting felt impossible. Retirement, a dream. Staying felt like a slow death. The scariest part, I didn't even know who I was without a title. Nurse Cindy. Yes, I'm a mom. Yes, I'm a woman of faith, a grandmother. But who am I really as Cindy? If you've ever stared at your workplace and felt nothing, drop a heart in the comments because you're not alone. If you've cried in your car before or after shift, you're not alone. Leaving nursing felt like jumping off a cliff in the dark. Nursing was safe. I knew what was expected of me. Walking away felt reckless. The biggest fear? That my skills wouldn't matter anywhere else, that I wouldn't know what else to do. And I thought, who the heck is going to hire a nurse to do anything online that is not related to nursing? But that's the biggest lie we're told. Our skills are not just transferable, they are golden. I'm going to show you how I connected my nursing skills to a whole new online career. It started with one conversation. A trusted friend and mentor suggested digital marketing. She was starting out. A lot of people in this program were making big bucks. The founder of this program made her first $1 million in 17 months, and now she's a multimillionaire. Now she can live off of her affiliate income, right? Who doesn't want that? Every skill described to be successful online sounded like nursing. Understanding needs and pain points, that's community health. Creating educational content, health education. Analyzing data, that's outbreak management. It hit me. I wasn't starting from scratch. I'd been doing marketing disguised as public health all along. If that just gave you chills, hit the subscribe button, because next I want to show you how I made the leap with zero experience. Once I saw the connection, that light bulb went off. Everything started to change. There's tons of free courses, YouTube deep dives, late night study sessions after work. Eventually, I enrolled in a digital marketing program that provides a certificate, so I can market myself as having expertise in digital marketing. It's focused, skill-based learning. Yeah, I was tired, but this was different because I was hopeful. I could see the potential. I could see the future. I could see that retirement that I had been dreaming of for so long. But then came imposter syndrome. My resume screamed public health nurse, so I translated it. Investigated outbreaks, managed data-driven audience engagement strategies. Boom! I had it. That was my secret weapon. Being a nurse showed I am capable, multifaceted, multi-talented. About 6 weeks after I started learning, I started earning. Made my first sale. When you get that notification, there is nothing like it. And the best part, I made 100% profit. So that one $900 sale was more than I would make in an 8-hour shift at my hourly rate when I retired. Now, a little over a year later, I'm living my dream. I'm retired. I don't punch a time clock. I don't answer to anybody else. I'm learning new strategies. I work on average 2 hours a day. Video editing has stumped me, but it is something that I'm determined to conquer. And hopefully you'll see proof that I'm improving in this video. But that's what I'm saying. Retirement doesn't mean you go away to die. I knew I still had to bring in extra income because what I had saved was not going to be enough. But I could not continue to go to a job that was draining me. I couldn't do it. I wasn't giving my best. I wasn't enjoying it. Now my schedule's my own. Some days I work a lot. Some days I don't work at all. I can go to lunch with friends. I can travel. I can volunteer. And my life feels like I have meaning again. I'm still serving, but I'm serving in a different way. So that ghost of 78, it is gone for good. So if you're looking for a program that's going to teach you digital marketing, whether it be just reselling the same product or how to build up passive income, develop your own product to sell, this is the place you need to be. So hit subscribe and grab my free blueprint that's linked in the description. That's the exact blueprint that I have used to get started and earn online. See you on the next one.